we are going to talk about working with us in staffing. During this video, we will cover your role as a healthcare professional at Interim HealthCare Utah, job duties, how to schedule and cancel shifts, and other scheduling policies. As a nurse with Interim HealthCare Utah, your primary role will be to care for patients in a variety of healthcare settings: long-term care, skilled nursing, rehabilitation, hospitals, and clinics, with medication and treatment management, wound care, monitoring patients for signs of illness, injury, or decline, and managing the different employees working the floor alongside you. As a CNA or personal care aide with Interim HealthCare Utah, your primary role will be to assist patients in a variety of healthcare settings, such as long-term care, assisted living, rehab, hospitals, or in their homes with ADLs and IADLs, such as bathing, toileting, range of motion, transfers, light housekeeping, meal prep, etc. In this section, we will cover all things scheduling, from the different apps you'll need to use, how to pick up your first shift, and what to do if you should need to cancel a shift. Param is our scheduling platform. You will need to download the Param app on your phone. You should have received an email from them by now with your username and password information. However, please keep in mind, until you come to the office to activate your account and complete your drug test, Param will not allow you to log in. Param is how you will pick up shifts, clock in and out for your shifts, and verify that all your hours and pay look correct each week before payroll is submitted. The great thing about working for Interim HealthCare Utah is you get to be your own boss. You have full control of your schedule. You can work as little or as much as you'd like. We will never tell you when or where to work, but we do expect at least one shift per week for most of our employees. If you have a vacation or busy week, just let us know. The choice of scheduling is up to you. Designated shifts are our on-call shifts. They help us to protect against last-minute call-offs between the facilities or with our own employees. With designated shifts, you are on call for the first 2 hours of the shift. So, for example, if you pick up a 6 to 2 p.m. designated shift, you will clock in from home at 6 a.m. Then from 6 a.m. to 8 a.m., you are on call, dressed in your scrubs and ready to go. During those first 2 hours, we will call or text you to let you know which facility you will be going to that day. From there, you will stay clocked in and drive to your shift. Once you get there, you'll clock out of your designated shift and into the facility shift. If you don't get called out within those first 2 hours, you're good to go ahead and clock out and go about your day. If you choose to pick up designated shifts, please keep in mind that you need to be willing and able to go to each of the facilities that we staff for in your territory. Designated shifts are by invitation only and pay higher than the regular rate whether you get called or not. Because you have full control over your schedule and can pick up the exact shift days and times that you are wanting to work, we do ask that you be mindful of your schedule before requesting a shift and responsible to work the shifts you choose to work. All cancellations, no matter how much notice, bugs facilities and makes things harder for all of us. However, if you do need to cancel a shift, we will need to find a replacement for you first, prior to removing you from the schedule. If we are unable to find a replacement for you, you will still be expected to work the shift. If you are sick or have an emergency, please call us immediately. We will request a doctor's note or incident report from you in order to excuse the absence. Please always communicate with us regarding your schedule. If you are unable to work for any reason, we have to know about it. If you choose to not show up without letting us know, it will be marked as a no-call, no-show and will be taken as your voluntary resignation from Interim HealthCare Utah. Make sure this number is saved in your phone. We are standing by 24/7, 365 and ready to help with whatever you need. When you call, you will have the ability to get right to the department you need to speak with. Now let's dive into what are the shift expectations. At Interim HealthCare Utah, we have built a reputation as one of the best staffing agencies rated by both facilities and employees. When you join our team, we expect great things from you. The work we do is very important and deserves your very best. As an elite member of our team, we expect you to show up on time, come to work prepared physically and mentally to give your best, be a great teammate, always looking for ways to help, have a positive, can-do attitude, and smile often, communicate well with the office, Be reliable. When you request and are scheduled for a shift, we are counting on you to be there. It's important to understand facilities don't ask us for help when things are easy. They ask us for help when things are hard. So, you are choosing to go into difficult situations. They will be under stress and may be impatient with you. You have to have the confidence that you know how to do your job. A good idea is to introduce yourself to whoever is in charge and let them know that you are there to help. Fact of healthcare. If you didn't chart it, it didn't happen. Make sure you have access to the facility charting system early in your shift. It's usually better to stay a little longer to finish your charting. If not, facilities will either ask you to come back and chart without additional pay, or they will ban you from returning. Sadly, facilities will sometimes cancel your shifts. We will try to find you another shift. Regardless, we will pay you for 2 hours if you show up and are sent away, but only if you call the office and get authorization to leave so we can verify the cancellation. Being a superstar is the best thing you can do to avoid being canceled. Show up ready to work, have a great attitude, be a team player, show up to your assigned shifts. Present yourself as someone valuable to them. Be someone who is hard to cancel. Make sure this number is saved in your phone. We are standing by 24/7, 365, and ready to help with whatever you need. When you call, you will have the ability to get right to the department you need to speak with.